Hi, I'm Dr. Fiona Caldwell, and I'm a veterinarian at Idaho Veterinary Hospital, and I'm answering questions from Pets Best Facebook page today. And this question comes from Janet, who writes, "My dog had a seizure and I took her to my veterinarian, and the veterinarian wants to wait to put her on seizure medication. Is this okay?" I'm sorry your dog had a seizure. This can be really a frightening and scary thing to watch. Seizures that are caused by epilepsy happen in less than 1% of dogs. Typically what you'll see is the pet losing consciousness and paddling their legs or jerking or convulsing, and it can last for a number of minutes. Definitely make an appointment with your veterinarian if you ever suspect that your dog has had a seizure. So you were right to go to your veterinarian. Typically the vet's going to want to run some type of lab work, some other diagnostic testing to make sure there isn't a different underlying problem causing this seizure. Kind of as a rule of thumb, dogs less than a year of age that seizure are typically suffering from some kind of infectious problem, either viral or bacterial. Dogs from about 1 to 6 to 7 years of age, typically the most common cause is epilepsy. Dogs older than 7 that come up with seizures, unfortunately this is often related to something outside of epilepsy. Scary things like a brain tumor or liver disease or some other problem. So depending on how old your dog is and how the seizure was, what the seizure was like, it actually might be okay for you to wait to put this dog on seizure medication. There is a decent percentage of the canine population that will have one seizure and then never have another one. Your veterinarian probably doesn't want to put your dog on seizure medication if he or she is one of those dogs that never has another seizure. Reasons that I would put a dog on medication would be if they have seizures that last more than 3 to 5 minutes. Try to take a look at your watch or take a look at the time on your phone so that you can know exactly how long it was. This is going to help your veterinarian to better treat your dog. If a seizure lasts more than 3 to 5 minutes, this is an emergency and you should bring your dog to a veterinarian because their body temperature can raise quickly and can be a problem. Especially as pets age, seizures that last that long can cause problems with the brain too, cause brain damage, that type of thing. If it's a quick seizure, 20-30 seconds to a minute, and your dog pops out of it, it isn't necessarily an emergency, but you should probably schedule an appointment with the veterinarian if they've never had a seizure before. If your dog continues to have seizures and they're getting to the point where they're once a month or 2 to 3 times a month, at some point the frequency is going to warrant medication. Talk with your veterinarian, and there are seizure medications that typically work really pretty well for dogs and can help control their seizures. If you guys have questions for me, feel free to post them at Pets Best Facebook page.